Hey everyone, my name is Dr. Jess. I'm a nurse practitioner here at Secoya Health in Woodbury. I'm one of the providers in the clinic, and I just wanted to thank you for your time for joining us for this DPC seminar. DPC stands for Direct Primary Care. So if we've got you, if that sounds like what you're here to learn about, you're in the right place. And I want you just to get comfortable. We've got some great information for you. We both about Secoya Health, but also about direct primary care specifically. And so again, just take a seat, get yourself comfortable, and we'll take some time to share our information with you and allow you the opportunity to ask questions throughout this presentation. I hope everybody's having a good day. All right, so as I said, my name is Dr. Jess. I've been a nurse practitioner since 2010, and I've worked in various care settings. I like to share a little bit about myself with you because as your provider, I am hopeful that you have the opportunity to get to know me. And I always like to start this conversation with a little bit about you and what's important to you and why you might be searching out alternatives to traditional healthcare. And so if you have a minute and you want to type something in the chat about what interests you about direct primary care, or maybe about an ailment or something that you haven't been able to get resolved in traditional healthcare, that would be super helpful for us so we can focus in on our presentation so that we can present more specific to what your needs and wants are. And if, as always, if I don't get to your specific question or concern, please feel free to email us at heal@Secoya Health. That will also be at the end of the presentation, and we'd be happy to respond to you and follow up if your question or your statement is not answered. So thank you again for engaging. So I also like to share a little bit about me. And so I'm a mom of 20 plus years of nursing experience. I have experience working in specialty care areas like sleep medicine, women's health. I've also worked in generalized family practice settings, urgent care. I really enjoy working with the pediatric population, prenatal, postnatal, postpartum. I enjoy helping women if they're struggling with issues with breastfeeding, mastitis, just generalized women's health concerns, but also with individuals who are maybe struggling with recurrent infections like UTIs. We have a lot of tools in our clinic here. So we know that everybody has reasons for why they're seeking healthcare and maybe looking for an alternative. And so I just wanted to share a little bit about myself so that you know, if you choose Secoya, who you'll be working with so that you have some background about me. So one of the questions that we often get asked, or we maybe ask the participants who come into the clinic, is why change providers? So if you feel maybe you're just tired of going to the doctor and waiting for long periods of time, maybe you are having challenges with getting in to see your provider and you're always getting to see maybe somebody else in the practice who isn't your doctor and you don't feel heard. Maybe it's something that you're feeling like you continually go back for the same question or concern physically, and you're just not getting to the root of why that is happening for you. And you're also not being provided tools that can help you start to get help you resolve those symptoms. And so we're here at Secoya because we're very passionate about root cause. We're also passionate about health prevention. And we often work with individuals who've been challenged over their lifetime with those issues. And we really appreciate hearing and having the opportunity to be heard and listened. And you often know the answers to your issues. It's just getting to those and having the ability and the time in the clinic to have those conversations so that we can get to root cause and help resolve your symptoms so that you can go on living your best life. So as I said, your why might be very different than my why. And I always like to allow individuals the opportunity to share with me a little bit about what their road was that they traveled and why they're seeking an alternative. As you can see here in the image on the left, or maybe on your right, Billy and I are playing doctor. So far, I've kept him waiting 3 hours. And I have to be honest, I've worked also in traditional healthcare, urgent care, family practice settings where it's true. Individuals sometimes do wait to see their primary care provider a long time, 3, 4, 5 hours, even in urgent care and emergency settings. And so I just want you to know that we operate differently than traditional health clinics. We run pretty much on time. We have same day, next day, and virtual appointments available. And if that's something that we can do to help you out, we'd love to offer that to you. If you have specific questions about or statements about why you're interested in changing providers, and you like to type that into the chat, just to keep some dialogue going and open, you might notice that people who are typing in the chat have something similar to you, or maybe something you haven't thought of. And so I'd like to invite you the opportunity to do that as well. So diving a little bit more into your why, for us here at Secoya and me personally, I value whole body health, having natural options. So some people, especially if they're maybe in their early 20s, 30s, 40s, 50s, and beyond, to be honest, it could be anyone. You're just looking for an alternative to the traditional pharmaceutical prescription that is being handed to you each time you go into the office. We value our bodies and believe that the body is designed to heal itself if given the right conditions. And so we work with you, if it is your goal, to optimize your health and your wellness and offer you natural options to support your body, so that if you're struggling with blood pressure or weight, or even type 2 or type 1 diabetes, if your blood sugars are issues for you to control because of the way your body is metabolizing foods you ingest, we can work with you and troubleshoot on a lot of different levels and look for and support your body and you with natural options if that's something that you value. Of course, there might be a time and a place where prescription might be helpful, and I can also prescribe traditional medications for you. I want you to understand that here in the clinic, we very much feel that a lot of every participant that comes to our clinic is like family. We want them to feel heard and validated and supported. And so we pride ourselves in being able to deliver that service. And we hope that that's something that would resonate with you when you come into the clinic as well. Direct primary care is a focus. So we focus on, and I use the image of a tree here because we look for root cause. You know, if there's something going on in the roots, or maybe the roots are cut off, or you're feeling some sort of dis-ease, maybe you feel pretty well and you just want some sort of insurance or coverage for the what ifs. You know, what if you get a UTI? What if you cut your finger? What if you had something happen and you just have a question about a health question that you want to get an answer to? That is what direct primary care is. It's about building a strong foundation for you, or the roots, so that you can blossom into this beautiful, healthy individual who is able to maintain health and wellness in a way that is meaningful to you. You know, it's I can give you advice and recommendations, but really we view health here as a partnership. And medicine is not healthcare. Medicine is actually sick care. So if you fuel your body with good foods, vigorous exercise, great friends, sound sleep, and mental stimulation that's healthy, that is healthcare. And that's what we're about here at Secoya Health. So if that's something that resonates with you and you're more about health prevention than managing health conditions, then we're probably going to be a right fit for you. Care in general is very different here at Secoya. We believe that no one thing causes any one thing, and that no one thing fixes that any one thing. We, as you see here on the image, There's all these things that play into being a healthy individual, and it takes a lot of hard work. So it's maintaining and getting half your body weight in ounces of water, making sure you're getting in the sun, going for walks, doing breath work, eating nutritious foods. It's supporting your structure with yoga, HIIT training, stretching, resistance exercise, and Pilates. It's neuroemotional. It's having those hard conversations, setting boundaries if you feel like that's a fit for you, getting sleep, breathing that fresh air, getting in relaxation and massage to achieve unlimited health. And through direct primary care, this is our, wish for everyone involved. But if this doesn't interest you and, working on every aspect of care isn't in line with what you're looking for at the moment, then, I want you to know too that we'll meet you where you're at. So we will also support you if you want just something to set it and forget it, have it there if you need it. We have that option for you. And along with your membership, you're also going to qualify for pulse magnetics, and we can talk a little bit more about that. If you have a specific question about how care is different that wasn't answered, or you have lingering questions, also please feel free to put those in the chat. Also, just want to invite you to give a thumbs up or a smiley if this message is resonating with you. And it's always good to have feedback from the individuals here on the call with us today. So thank you. We have services in the clinic that involve IV therapy, and what I like to highlight here is that not that you have to or are required to receive IV therapy, but that it is a tool in the clinic that we have that isn't offered at any other traditional healthcare setting. Nowhere else can you go to your clinic and receive IV therapy when you're not feeling well. But we have that service available, and the benefits are so great. You can get B12 injections here. B12 helps your body break down carbohydrates and proteins to allow your body to metabolize foods more easily, and it gives you a burst of energy, helps facilitate weight loss. Also, IV therapy is more bioavailable. So we've got a great supplement line here that allows your body to recharge and fuel itself so that you can optimize your overall body function. We also have some recommendations that we could make if there's, something that's underlying for you and you aren't sure why it's happening. We have some testing that we can do. And as a member in the clinic, you are getting pass-through pricing. So there's never going to be unexpected costs, no additional bills. Your membership covers all of your office visits. The only additional fees that you might have is if you decide to do a lab, for example. So how does traditional healthcare work? Here is what we don't do at Secoya, but what you often see is the insurance company being the middleman in between the physician and the patient or participant in our case. And I think it's a disservice and something to be open-minded about to really think about, should insurance companies be dictating the care that you receive? Are you open to that? Are you okay with that? At least ask the question to yourself and your family so that you can come to the right answer. And I'm not going to answer that for you. I obviously believe that being able to serve people without limitation is really helpful. I don't think cookie cutter medicine is necessarily beneficial for everyone. And I also like to have more of a functional medicine approach to how we treat and work with individuals so that we are able to, again, get you feeling optimal. We shouldn't be dragging every day, relying on, all the things to get us through our day, such as coffee, energy drinks, you name it. If you're feeling fatigued, let's talk about it. Let's talk about why you're there. And again, not limited by insurance. We're able to, for one low monthly fee, or if you pay in full for the year, we're able to provide those services for you for that entire year. So with the direct primary care model, or you can obviously see the difference. So direct primary care is where I would work directly with you. We set your health goals. We talk about what your long-term, maybe your short-term goals are, and set some personal, I would say, focus in on how we're going to achieve those goals. So it's, if you're working on weight loss, it's going to be that. Let's check in 2 weeks, maybe in 4 weeks, and just see how things are going if you're going to start a 28-day detox, for example. Versus like the conventional traditional healthcare system where you have the provider, then there's an administrator, a regulator, an insurance company, and then it gets to you. And you really don't have a voice in the care you receive. I think there's a very unusual times where traditional healthcare allows you to speak your voice, be able to go in and tell your provider you'd like a full thyroid panel and they actually order it for you. It's just things like that that really are can be frustrating as a patient. And I know I've been there when I needed an MRI, for example, and my provider wouldn't order it because the insurance company said that we weren't able to get that test. We just remove that middleman. And if you come in and we see a need for an MRI, we order it. We send you over. If you are a person who has insurance, you're able to bill that through your insurance company. If you are without insurance, then we just work with you and get cash pricing, which is sometimes saves you money anyway. So we just like to give you the visual. If this resonates with you and you want to give a like or a love or a smiley face, please put those in the chat. And if you have questions about how we're able to deliver this care, also put those questions in. And again, if we aren't answering your questions as we go, we'll definitely follow up with you after we complete the presentation. So cost is one of the biggest financial barriers or reasons why individuals are seeking alternatives to their health plans. It is expensive to have health insurance. It's expensive not to have health insurance. But what direct primary care does is it offers you a reduced overall cost. Some of the questions that we often get about the cost of insurance is, well, because direct primary care is more for like the family practice piece of it, for the everyday coverage, it's not for the catastrophic coverage, right? So here we have a 26-year-old, an example. So if this 26-year-old was on a health share with direct primary care, overall, she could expect for her catastrophic coverage, DPC membership, and one incident in a 12-month period to pay around $5,000. Now, I know plenty of people who are at 26 and paying way more than $10,000 for their health insurance premiums, co-pays, and an incident. If their deductible is $10,000, they're responsible for that full amount. And so we know that direct primary care has proven to reduce overall costs for individuals. So if you're an individual in that age bracket and you're looking for an alternative to traditional healthcare, and what we've been talking about today really resonates with you, please reach out. You can sign up directly today and get started. So I have another example here on this screen, that a family of 4. So typically a family will have insurance. Again, there's going to be some sort of premium and incident costs. So if their deductible again is set a little bit higher, not only are they paying, approximately $5,000, $6,000 in premiums, but they have the incident that they have to cover because they had a high deductible plan. And even if you have a lower deductible, you're paying higher amounts in your premiums. And so we just really ask that you look at these costs and really compare it to what direct primary care can offer you. And we have a partnership with Secoya Health, and you are able to use those QR codes to pull up information about Secoya. They offer the health share. And you get a discount on your primary care if you get a discount for your health share if you are a direct primary care participant. So just something to look into. Some of the things that I guess I personally feel is that I wish I would have known more about direct primary care years ago. I think it's got a great place. It sort of brings that family doc feel back to healthcare. It allows that partnership, that bond to be created. And ultimately here, we at Secoya believe that we believe in the price, and we believe in price transparency. So we're going to be very upfront. You know that you're going to be given, X amount of dollars will be your cost to do an intake exam. If you opt out of that, then you'll know what your monthly membership is going to be costing. And if you ever have anything else above and beyond, for example, like lab work, that would be something that's provided to you before you even have the test drawn, and you pay for those same day of service. So what's included in your membership? All the things that you'd normally go to your primary care provider for are included here. I'm well trained, like I shared with you earlier, in wellness exams for adults, children, and geriatric populations, weaning off of medications if that's something that interests you. I have helped several people transition onto some alternative natural options and then eventually get them weaned off. We can make supplement recommendations, help with detox support, work through fatigue and sleep issues. We offer well women visits, including pap smears, chronic symptom management, wholesale lab discount pricing. And you also have other modalities in the clinic that you may not receive. And we find that you will not receive at any other primary care clinic anywhere, basically. We can also offer some basic urgent care needs, so stitch removal, ill visits for UTIs, strep throat, cough, cold, allergy symptoms. We offer you same day and next day visits, telehealth, and concussion consults. So if these are things that speak to you and you think this would meet your needs, again, you're welcome to sign up anytime and get started. If you have additional questions about a service that isn't listed here, also please feel free to drop us an email and we will follow up with you. So here at Secoya, we also view healing as a partnership. We believe that you're a big piece of your health and well-being, and that I personally feel that your goals for your health and wellness are my priority. And so what I view my role in this partnership is that I'm going to guide you, provide you strategies, give you tools to encourage you and teach you. I view my role to empower you and provide understanding. And your part is to really take responsibility, to do the work, take the action, have tough conversations if that's part of what you need to do. Let go of your old patterns and challenge some beliefs that you might have. Be curious and open. And I'm going to match your energy. So if you're coming in and working hard on yourself and you've got a goal of losing 50 pounds, I'm going to match your effort. I'm going to meet you where you're at. If we want to get to that goal in 6 months, we're going to work hard together. And obviously you can do that in a healthy way. If you're not interested in doing a ton of work and you just want to have direct primary care in your back pocket in case something happens, I'm going to match that effort too. And I'm going to support you, and I'm going to be here for whatever services look like for you. So we believe that the natural healing force is within each of us. I'm botching this. So we believe that the natural healing force within each one of us is the greatest force in getting well. So again, just bringing things back to nature, and our bodies are naturally healing. And if this resonates with you, just give a like, a love, or a thumbs up, and put some information in the chat or comment. So today is the day you can change your life. We ask for you to consider, if you're interested in signing up for DPC, to go ahead and do so. If you have questions or concerns that weren't answered today, you can call the clinic and schedule a consult with myself to meet one-on-one to gather more information and to see if this is a good fit. The other option is to schedule a DPC intake exam, and we'd love to serve you and meet you where you're at. Thank you again for your time today. And if you have questions, I like to always pause at the end and allow participants or individuals who are interested in direct primary care to go ahead and ask their questions. You can throw them in the chat. And again, if I think one of the biggest questions that I'm always asked in the clinic, and I can see are popping up, is like, what does an intake exam involve? And that's a great question. I'm just going to briefly answer that it's a 60-minute appointment where we focus on you. And I like to interview you and ask you what your health goals are, where you've been, what your why is for seeking Secoya Health for your healthcare. And we really prioritize your health goals. So if your goal is to lose weight, for example, we're going to talk about strategies to do that and what you'd be open to. If your goal is to wean off your blood pressure medications, we're going to talk about how long have you been on it? Where have you been? What do you plan to do to achieve that goal? And how open to being off the medication are you? Because some people say it and then they're a little bit reluctant and they might be a little bit wishy-washy about partway through. But that's that accountability piece. Like, I'm going to bring it back to you and say, hey, you were dead set on this was your goal, to wean off this medication. And again, going to meet you where you're at. If you decide that that's not for you and you're uncomfortable, you got all the time in the world. We can just take time. We'll take a step back, take a deep breath. We'll allow your body, your mind, to sort of come back into peace. And when you're ready to start weaning again, we'll go for it. So it's super exciting. I love this role. I love to work on health prevention. We know that 80% of health conditions, probably 90%, are actually preventable. And so that's where I like to put my time, energy, and effort and match yours. So, all right. Thanks, everyone, for your time. Again, if we didn't get to your questions in the chat today, please email us at heal@secoyahealth.com, and we will follow up with you after this seminar.